Radhe Radhe and Namaste. Welcome to our JK Yoga Academy Health Webinar Series. Today we have Dr. Rekha Reddy ji with us. She's grown up in Midland, Texas. She graduated from University of Texas at Austin with a degree in business administration and earned her DDS from the UT Health Science Center in San Antonio. She currently has a private practice in Dallas, Texas, where she specializes in cosmetic dentistry and Invisalign treatment. And we also have Dr. Khandelwalji. He's the instrumental between us and the doctors. So thank you very much, Dr. Khandelwalji. And now let's go over to Rekha ji. She will be talking to us about healthy teeth and healthy body, healthy mouth and healthy body. Thank you.
Thank you so much. I'm just going to share my screen here. Okay. So like she said, my name is Rekha Reddy. I was introduced through uncle here, who I grew up with in Midland, and I typically lecture and speak to other dentists. So I'm really excited and really grateful to have this opportunity today to talk to the general population about dental and oral health. So thank you so much for having me. I really appreciate it. So I live in Dallas, Texas. Like she said, I graduated from the University of Texas, San Antonio for dental school. I am a speaker for Invisalign and Align technology, which focuses on treating malocclusion and bite-related issues with clear aligner therapy. So today we're going to talk about a few different things. The first thing we're going to talk about is how I like to categorize the three main areas of dental disease. We're going to focus on gum disease, tooth decay, and malocclusion, why we need to care about dental diseases, why they're important to our overall health, and how we can prevent these diseases. So the three categories that I like to break up dental diseases are gum disease, diseases of the gum and the bone, diseases of the teeth, which are typically infections or decay, what we typically will call a cavity, or malocclusion, which is the way your teeth bite together. So gum disease is officially known as periodontal disease or periodontitis. It is a chronic bacteria-induced inflammatory condition that affects the gum of the mouth. In more severe cases, it also affects the bone and the surrounding tissue around the teeth. If left untreated, these gum diseases can lead to tooth loss, and they've been associated with other systemic diseases, most notably diabetes and cardiovascular disease. And shockingly, what we've learned is that in the United States, over 50% of adults suffer from some form of gum disease. What's even more alarming is that globally, those numbers are even higher. Risk factors that can make you susceptible to gum diseases are plaque and tartar buildup accumulation. So what that is when food and saliva and other liquids mix in your mouth, and if we're not properly cleaning our teeth, this bacteria will stay onto the teeth and on the gum line and will turn into plaque and tartar buildup. So tartar is just a harder form of plaque when it becomes hardened, and at that point, you're unable to remove it with a toothbrush, and that's when you need a dental cleaning to properly remove that. Other risk factors for gum disease are age. Older people are at higher risk for that. That doesn't mean it only affects older people, but also young people as well. But traditionally, we see this in more as we age. Smoking and tobacco use, like almost all medical conditions, increases your rate of being affected by this. The more we learn now about stress and how stress affects our whole body, unfortunately, the mouth is not spared from that. So it is also increases your risk factors. Medications such as oral contraceptives, sometimes antidepressants, some forms of antidepressants, calcium channel blockers, if you're on those for heart conditions. These can all increase risk for periodontal diseases because they have effects on the gingiva or the gums in the mouth. Occlusion is the way that your teeth bite together. So if you have an improper occlusion, what we call malocclusion, that can also lead to different types of diseases of the gum and the bone. There's some other systemic diseases that are inflammatory, such as diabetes, rheumatoid arthritis, that have a direct link to periodontal disease, gum disease. And also, interestingly enough, poor nutrition as well as obesity both have a correlation with gum disease. So no matter which kind of end of the spectrum we're on, we're still kind of at high risk, and it's really important to maintain that healthy gum, healthy mouth. So here is a really surprising statistic that I found, is that 95% of the Indian population suffers from some form of periodontal disease. This is even more important as we're learning the links between gum disease and systemic diseases like heart disease, diabetes, and other such conditions. So why is it important to care about gum disease? This is why we're here today. We want to know why this is important, why we need to learn. Gum disease is the #1 cause of tooth loss. There's an increased risk of coronary artery disease in patients with gum disease, and diabetic patients. This is very important. Gum disease can also adversely affect the way that you can control your blood sugar. So more onto about diabetes and gum disease is what we call a bidirectional relationship. Both diabetes and gum disease are inflammatory type conditions. This link has been studied for over 50 years. And what we found is that patients who have diabetes are at a higher risk for gum disease, and patients with gum disease are at a higher risk for diabetes. So we kind of see that going both ways. And even the correlation is even higher in those patients who have uncontrolled diabetes. So very important to make sure we're keeping our entire body healthy, or keeping our blood sugar balanced and keeping our gums healthy. The good news is that we found that patients who are controlling their blood sugar and getting their gums taken care of, coming in for their cleaning appointments, seeing their dentist frequently, they are able to get both of those conditions under control. One thing that we see in patients with diabetes is that they have what we call a hyperinflammatory response in their gum tissue. And what that means is that the gums are going to get even more puffy and inflamed and swollen and bleeding than in a non-diabetic patient. And patients with the poorly controlled diabetes are going to be at 3 times greater risk for gum disease. And like I said before, inflammation is the common link here. That's what links the gum disease and the diabetes. You know, I'm sure we've all been hearing a lot about inflammation and inflammatory conditions. And like I said, the mouth is not exempt from those processes. So it's just something to keep in mind there. Another area that we see is pregnancy and its relation to gum diseases. Because of the hormonal changes during pregnancy, it exaggerates your body's response to the bacteria in the oral cavity. And it can cause a really inflamed gum, which is gingivitis. We see this in patients who are even really diligent about their cleanings and brushing and flossing daily. So it's really important to make sure you're on top of that. We'll see people will often report bleeding, swelling, and pain in their gums that they never had before when they're pregnant. So even more important to keep your mouth and teeth healthy during pregnancy, because we've seen that if you develop gum disease, it can lead to complications such as preterm labor, low birth weight babies, preeclampsia. Another condition I wrote on here was a pyogenic granuloma. What that is, this is a type of mass that grows on the gums, and we see this in typically almost 90% of the time in pregnant women. It is a hyper-inflammatory growth of the gum. It's kind of like a big ball that does have to be removed. But something to kind of just keep in mind there, that there is that link between keeping your gums healthy and keeping your baby healthy. So some other conditions that we're learning more that are associated with gum disease are osteoporosis, types of respiratory diseases, types of cancer, erectile dysfunction. Some of the newest studies that we've seen are linking Alzheimer's disease to gum disease, which is particularly important because we do see gum disease in our older population as well as Alzheimer's disease, and peptic ulcers, which is another newer kind of area. There's more and more studies kind of coming out every day that are linking this. So just more importance to taking care of your gums. So how do you know if you have gum disease? So gum disease, unfortunately, is oftentimes silent, and you don't really see symptoms until it's progressed to like a more aggressive or more chronic stage. But some of the signs you can look out for are puffy, swollen gums, redness in your gum area, bleeding when you're brushing or flossing, or sometimes maybe even eating. You'll notice some blood, plaque and tartar buildup, and the most common thing that you may notice or that your partner may notice is bad breath. So there's the bacteria that causes gum disease is going to change the oral environment and cause that kind of bad breath smell. If you notice gums that are receding, where you start to see the root area of the tooth, sometimes people will say, oh, I see like yellow down here, what is that? And it's under the white part of the tooth. And that's actually the root surface. So when we start getting recession of the gum, the root area of the tooth becomes exposed, and that can cause also a lot of sensitivity as well. If you notice pus in your mouth, any kind of like exudate, that can be a sign of gum disease or possibly infection. Sores in your mouth. And sometimes even we'll notice that our teeth don't fit together quite the same way anymore. That can be caused from gum disease affecting the stability of the teeth and the bone to where they now don't sit where they used to. And you might notice that your teeth don't fit properly. Or if you wear dentures or partials, you'll notice that they don't fit correctly either. Millions of people don't know that they have this serious infection. So it's really important to make sure that you are getting your checkups twice a year and seeing a dental professional. The next kind of area we're going to talk about is infections of the tooth and decay in the tooth. So I wanted to just give a quick little introduction to what a tooth is. Mostly when we think of teeth, we think of the pearly white smile. We think of like big white teeth. That's really just part of the tooth. That's a third of the tooth that we see above the gum and the bone. Underneath that though, there's still, you can see there's a long root in the tooth, and that's what anchors the tooth into your body. Underneath the enamel or the white part, there's the second layer of tooth. That's called the dentin. And underneath that is the root area of the tooth, and that houses the nerve of your tooth. Really interestingly, teeth all have their own nerve. I don't know why, but this is why when you get tooth pain, it's really, really bad, because that tooth has its own specific nerve supply and blood supply. So the dentin is what links that root area, the nerve area of the tooth, to the outside. So when you have tooth sensitivity, it's because there's tubules going from the nerve all the way out to the enamel. And if we sometimes abrade those tubules, that's when we can get root sensitivity. Or if we've eroded all the enamel away totally, we get into that area. So stages of tooth decay here. Decay always starts on the outside of the teeth. There's been a huge rise in dental decay. Clinically, we call that dental caries. You might also hear it referred to as a cavity. There's been a huge rise in cavities due to our diet changing globally in the US and globally with an increased consumption of refined carbohydrates. So the bacteria that causes tooth decay loves carbohydrates, and that's what it feeds on. So when we eat like anything, and we think of carbohydrates, a lot of times we just think sugar, but it's not just sugar, it's bread, other things like that, rice. So that bacteria feeds on the carbohydrates and propagates, and it's going to start to eat away at the enamel. Well, bacteria eats away at the enamel, not at too quickly of a pace. And if we can catch a cavity when it's in the enamel, a lot of times we can stop that from progressing anymore, or we can arrest it right there and reverse it and remineralize it. Once the bacteria gets into the middle layer of the tooth, the dentin, it tends to propagate exponentially. So it'll go faster and it starts to spread widely. Once you get through that dentinal layer of tooth, you hit the nerve or the root. If you notice on the last image there, there's a little like ball at the bottom of the root there. That is because the bacteria has gotten into the root area and now it's infected and there's nowhere for that bacteria to go, but it goes, so it has to go out the bottom of the tooth, and that's when it forms an abscess. So when we talk about dental infections, typically they come from decay starting at the top of the tooth or from the side of the tooth, going through all the layers of the tooth, infecting the tooth, and then bacteria has to come out the bottom. What you may see in your mouth is like a little pimple looking bubble type thing. Sometimes people will notice that if they push on it or touch it, it'll pop and they'll have pus coming out. Sometimes they will come up and go down as the infection process kind of wanes. But this is very important. Once you're at that stage, if the tooth is infected like that, it's going to need what we call a root canal. So that's what, if you've heard of a root canal, that's what a root canal is when we go in and clean out the root area. Also very important because these infections can travel to other parts of your body. There's some famous stories that you may have heard about a tooth infection causing brain issues. So very important, we don't want to let an infected tooth or a cavity, something that could have, if caught early, can be treated with a filling or possibly remineralized, turn into something huge that can lead to a big systemic issue. I wanted to talk a couple of minutes about teeth sensitivity because this is a question I get really frequently about why are my teeth sensitive and what can I do to fix this? So typically teeth sensitivity is caused from one of these four problems. The first one is gum recession, which we talked about. Gum recession is often caused from gum disease. It can also be caused from some other factors like orthodontic treatment. It can be caused from really aggressively brushing your teeth. And it can also be caused from your bite. Occlusion, or the way your teeth bite together, if you have what we call a traumatic occlusion, meaning your teeth don't really fit together properly, the forces are not going down your teeth in the correct way, this is going to cause like kind of a shearing force on your tooth, which will then cause it to become sensitive. Dental decay, obviously, cavities and infections are going to cause some tooth sensitivity. And lastly, external habits, which what I mean by that is typically it's clenching or grinding. When you're putting those clenching and grinding forces on your teeth, it can cause the teeth to become very sensitive. One other thing I didn't mention here, we frequently see sinus problems causing tooth sensitivity. The teeth on the top here have roots that go up into or around the maxillary sinuses here. So if you live in Dallas and you have really bad allergies like me, your sinuses are pushing on the teeth and it can cause some kind of generalized sensitivity. We typically can't really identify exactly where it's coming from. And you may notice if you're running or walking that you feel like a lot of pressure on the teeth. So that's another kind of cause there. But most importantly, if you are having tooth sensitivity, especially if it's been occurring for an extended period of time, you want to make sure you get that checked out because it could be something serious that needs to be treated before it progresses. So some of the ways to treat sensitivity, sensitivity toothpaste are great if you have recession and root exposure, like a Sensodyne. Crest gum insensitivity is another really great one. Fluoride treatments will help. Like I was talking about earlier, there's tubules that go from the nerve of the tooth out to the enamel. So fluoride and sensitivity toothpaste both, what they do is they block that so that air and other external factors, cold water, etc., can't get into that tubule and then irritate that tooth and make that, that kind of zingy feeling that when you eat like cold ice cream and it hurts. Sometimes if there's a lot of root exposure, you may need to get a restoration, like a filling placed on there to help cover that up. We see this a lot, especially in our periodontal gum patients, because they've had bone loss and gum loss and recession. So we need to now cover the root area so it's not sensitive. Restorations are also indicated if you have decay or a cavity or maybe a cracked tooth. So you might need a crown or a filling, something like that. Another thing about tooth sensitivity, the probably one of the biggest reasons why we see tooth sensitivity these days is because of whitening products. So you have to be really careful about what types of whitening products you use. So avoid whitening toothpastes because they tend to be very abrasive and they will wear down the tooth surface there. So the third area of dental disease that I want to talk about is occlusion, which is, again, the way that your teeth kind of bite together. We like to call occlusion is like the backbone in your body. So like your spine holds your whole body together, so does the way that your teeth bite together. A lot of people don't understand the importance of this, but this is really kind of the main thing that sets you up for a lifetime of keeping your teeth, which in this day and age, with proper oral hygiene, you should be able to keep your teeth from the time you get them till, you know, the time that we pass on. And malocclusion is basically when there's an improper relationship in the way that your teeth are connecting. So when we have an improper bite, it can lead to a few different things. I like to tell my patients that when your teeth are not hitting correctly, one of two things is going to go. It's either going to be hard tissue, like bone, or it's going to be soft tissue, like your gum. So either your tooth gets eroded away, the bone gets eroded away, or your gums get eroded away. Over time, as we bite incorrectly over, if you think about how many times a day you eat or your teeth touch, multiplied by the number of years that you've lived, like think about all those forces going on that tooth. So that's going to lead to fractures, cracks, breaks, wear, other kind of issues there. Another thing about malocclusion, which is the way that your teeth are situated, when we have crooked teeth or crowding, a lot of times we think that crowding is an aesthetic concern and that, oh, the crowding doesn't bother me because I don't really look at my teeth there, or I don't look at my bottom teeth. But more importantly, if we're unable to clean those areas because they're overlapped, that's going to turn into an oral hygiene problem. So I see a lot of people who've had crowding for many, many years, but because they're unable to clean there, the plaque in the food and the tartar buildup has accumulated. It's now turned into a gum disease problem. And now we've lost bone support around the teeth. And worst case scenario, that turns into losing those teeth. The last kind of consequence of malocclusion or an incorrect bite is temporomandibular joint disorder. So you probably have heard TMJ, people talk about it all the time. Well, we all have two TMJ joints, which is the temporomandibular joint, which is like right here. This piece of our head here, this is called the mandible. The mandible is connected to the rest of your head. If you've ever looked at like a skull, you'll notice that this piece here is actually its own piece, and it fits into the skull here. And the joint that connects those two is called the temporomandibular joint. So we all have two of those, but most of the time when you hear people say, I have TMJ, what they're referring to is a TMJ disorder. So TMJ disorders, or what we call TMJD or TMD, are musculoskeletal in nature, and they affect 5 to 10% of the population. After chronic low back pain, it's the most common condition resulting in pain and disability. We typically see TMJ patients in middle, like 40s and above. It's more common in women. It's a really it really affects your life. It can make your life really miserable, having pain in your face and in your jaw constantly. So people have varying symptoms. So some people will say they have popping and clicking in their joint. Popping and clicking in your joint is pretty common as long as it's not accompanied with pain. So if you just have popping or clicking, that doesn't mean you have any kind of issue. So you don't have to be worried about that. But if in addition to that, you're getting pain in the muscles over here, or maybe headaches in your temples, you wake up with headaches every day, jaw pain, even neck, shoulder pain, limited mouth opening. You want to be able to open 2 to 3 fingers with. When I say that, I mean you put your fingers like that. Some people also will say they have ear pain, ringing in the ears. We see a lot of patients who've been to an ENT, been to their MD, and nobody can diagnose the ear pain, and it's coming from their TMJ, which makes sense because the TMJ is right here next to the ear. So that inflammation in that joint capsule is causing, some kind of thing there. So what causes TMJ? We talked a little bit about this. Your bite can be one of the reasons. Function, which is the way that you're kind of eating or masticating or kind of just living. Trauma, we don't see this as often, but like car accident or an injury. I had someone the other day who fell off a tree when she was a little kid and like fell on her face and like it kind of knocked everything off a little bit. That can be a cause for, your joint getting out of proportion. 90% of our TMJ disorders, though, are muscular, which is unfortunate because it's painful, but fortunate because it's easier to address. The other 10% are either related to the joint itself or the capsule around the joint. Another really, really big factor causing TMJ disorders is our posture. So all of us now, we're all on a computer right now, or you're on your phone, and we tend to be really forward head position, typing on our laptop all day, and we put a lot of stress into these muscles here. So when our head is forward, where it should not be, it starts to pull the jaw out of position. And these muscles, we have a lot of little muscles that are holding your jaw to your head. Those muscles get really inflamed. And it's very difficult because there's tiny muscles and they're inside your mouth. So you don't really know what's causing the pain. But typically what I see is that posture, the more and more as we've become more reliant on our smartphones, is really exacerbating this condition. During COVID, as more people are working from home, we're seeing like a huge rise in TMJ disorders. Probably because of posture, probably from incorrect work environment, and also from stress, obviously. Stress itself is not necessarily a cause of TMJ, but it correlates with it. So stress is causing the clenching and the grinding, which is probably also causing the TMJ. Or you're having inflammation from the stress response in your body. So all of that kind of goes together. Another thing that we've seen a lot during COVID pandemic is a lot of broken teeth because everybody's very stressed out. There's a lot going on in the world. And I've seen more broken teeth in the last 3 months than I have in my 10 years of practice. So it's been very interesting. So a lot can be said about de-stressing, meditation, yoga, whatever it is that you use to like reduce the stressful level in your life is going to benefit every aspect of your life. So methods to treating TMJD. So typically a first line defense from your dentist is usually a night guard. We give you a night guard more to protect your teeth. It's not really going to stop the clenching, grinding activities. But what we want to do is we want to protect your teeth. We want to protect your dental work from getting destroyed. There are medications that we sometimes will use, typically use anti-inflammatory muscle relaxers, something like that. We don't like to use this chronically. It's also a good way to diagnose if the problem is muscle related or joint related. We do Botox injections. What we do is we use Botox injections in this muscle here is called the masseter, and this muscle here is called the temporalis. Those two muscles together, when you bite, you might notice that if you put your fingers here and bite, you'll notice that this gets clenched together, and same thing up here. So someone who's been clenching or grinding chronically is going to have hyperactive muscles here. So the Botox injections can kind of weaken the muscle to get you out of that kind of spasmy period. One of the best ways to treat TMJD is Also, the most time consuming and the one that nobody ever wants to do is physical therapy and massage. Because what I tell my patients is, if you were a runner and you run every day for 2 miles, you would stretch your hamstrings when you get home, right? Of course you would. Well, we use our mouth every day. So we're eating and we're talking. And then if you also have a functional habit like clenching or grinding, then you're using your mouth way more than you should be. And those muscles are really, really overused. So we need to stretch those as well. Um, it's not super easy to demonstrate that over Zoom, but there's a lot of like YouTube videos and stuff you can look up that will help you to kind of stretch these muscles here. Even, at the end of the day, every day, I like to stretch my whole neck out to make sure all of this muscle down here is stretched out as well. One thing I have all my TMJ patients do at the end of the day, you take like a towel or roll it up kind of into like a log and put it under your neck and lay on the floor to help open all of that up. And that will kind of get your head into a better position. Especially after all the forward head movement all day, it's going to kind of put everything back together. And then you can kind of like at least sit up straight, get your jaw into the correct alignment. And that will help a lot too. Hopefully before you go to bed, you can kind of relax everything and go from there. The last thing on here is surgery. So surgical options are typically last resort. They have mixed efficacy, and they're really only helpful if the problem is joint related. So like I said, we like to kind of rule everything out first before we send you to the oral surgeon and we start talking about surgical options. Really important thing to keep in mind here when we're talking about TMJ and grinding and clenching. The more we've learned in like the past 10, 15 years is that clenching and grinding, these are disorders we call bruxism, can be a sign of a sleep disorder. And when I say sleep disorder, what we're referring to is obstructive sleep apnea. So when you're having an apnea, or an apneic event, what that means is you stop breathing temporarily. So your body notices that you're not breathing and it wants oxygen. So one of the ways it tries to wake you up is by clenching and grinding your teeth. So you're triggering yourself to kind of wake up. That is so if you notice that you're grinding your teeth, or you notice your partner is grinding their teeth and you hear this at night, something that it's important to bring to their attention, that this could be related to some kind of sleep disorder. Same thing with snoring. So really important things you want to talk to your dentist about. Your dentist can then get you in touch with an ENT or a doctor who treats sleep disorders, and we can kind of get together to work on that. With sleep disorders, there's been obstructive sleep apnea is everywhere now. Everybody is talking about it. We know that it affects every part of your body, and it's so important. And as dentists, we kind of come into this at the beginning and at the end. So when we'll notice first if you're clenching, grinding your teeth. So we will bring that up to your attention. Then you can see your MD, get your sleep study done, get your diagnosis. So patients who have mild to moderate sleep apnea often do not want to wear a CPAP, which is like that machine that goes over your face and it breathes for you. So if patients are not able to wear the CPAP, or if they have mild sleep apnea, sometimes you'll get referred back to your dentist to get an oral appliance made. What that is it's kind of like a night guard, except you have a piece on the top and the bottom, and it repositions your lower jaw while you're sleeping to open your airway. So this will open the airway to allow more air to come in so you can breathe easier. So this is one of the areas that we work a lot with ENTs and sleep MDs to help patients who have these kinds of problems and can't tolerate CPAP. So we've talked a lot about the different types of dental diseases. And so why should we care about these different dental diseases? So tooth loss is is a really important reason why, like I said before, there's no reason nowadays that we can't go from the time we get our adult teeth in to the time we leave to keep our teeth, or at least most of our teeth if we can. Losing teeth is going to affect the way that your teeth function together. When we lose teeth, the teeth around it start to compensate and shift into that space. So they'll start to, if you're missing a tooth here, the tooth behind it will start to fall over and the tooth above it will start to come down, which is going to weaken the integrity of those teeth, those surrounding teeth, as well as the other teeth in your mouth. We've learned that there's a systemic link between dental diseases, cardiovascular disease, heart, diabetes, rheumatoid arthritis, etc. Obviously, aesthetics. Everybody wants to look beautiful forever now, so we want our teeth to also be young and beautiful. Pain. Nobody wants to be in pain, and for whatever reason, God created us with teeth that have so many nerves that any kind of issue with your teeth is so painful, and we really don't want to deal with that. And of course, you're probably going to have a dental emergency on a Friday at 7 p.m. And, you know, we're not doctors. We don't work on the weekend. That's why I went to dental school. I'm not taking call. So you're going to have to wait till Monday. So, and then lastly, like taking care of your teeth can be expensive. I am very focused on preventative dentistry, putting your teeth in the correct alignment to begin with. I see patients as young as 6 months old when they get their first tooth. And I think my oldest patient, or most seasoned patient, I should say, is 97 years old, 97 years young. Her and her husband come see me from the retirement community. And so we see, you know, a wide variety of different kinds of patients. So lastly, brushing and flossing. This is going to be the biggest way to really prevent dental diseases. You want to know your risk factors. Obviously, if you're diabetic, that's a huge risk factor for gum disease, as well as smoking. You know, in this day and age, I don't know who smokes anymore, but if you do, you should just stop because it's not good for anything, including your teeth and your gums. One thing with Indian population is betel leaf is also a really high risk for oral cancer and other kind of oral diseases. So, and diet. Refined carbohydrates are what we know causes tooth decay. There's been studies that refined carbohydrates have increased the rate of tooth decay, I think by like 70% or something really, really high. You want to go see your dentist at least twice a year. If you are a patient with gum disease, you may notice that your dentist wants to see you every 3 months. This is really important because there's a specific time where the plaque regenerates. So we want to see you within 12 weeks to make sure we prevent that cycle from continuing. Let's see, I'll come back to this. I just wanted to talk a little bit about, these are some products that I recommend. These are my favorite products, so I just like to tell everybody this. You want to use a soft bristle toothbrush. So a lot of people think the harder the toothbrush, the better it's cleaning your teeth. That's actually not true. So you want to use, if you're using a manual toothbrush, which is like just a regular toothbrush, you want to make sure it says ADA soft on it. Electric toothbrushes are best, not like a spin brush. Those don't really do anything, but you want to get like either an Oral-B electric toothbrush or a Sonicare. My favorite electric toothbrush is this one in the picture, which is the Sonicare Diamond Clean. My favorite toothpaste right now is this Crest Gum Detoxify. As I was saying earlier about toothpaste, something that's really hard right now is everybody wants their teeth to be white. So all these toothpaste manufacturers are putting whitening products in everything. And the whitening is actually really abrasive, especially if you have gum recession and your root is exposed. That area is not as strong as enamel. So when you brush with a whitening toothpaste, you're actually abrading away the root of your tooth and getting even closer to the nerve. So I like this Crest Gum Detoxify because of its, we go off of an abrasive scale. So the This is one that I like. The other one is Crest makes is called Gum Insensitivity, or any Sensodyne products are good as well. Mouth rinses. This rinse here is called Closis, and this is a really good rinse for people with dry mouth, which we do often see as well. And I had a couple videos here that I just wanted to show about. This first one here is, can you see the video? Okay, this first one here is talking about decay and how decay progresses.
The process of tooth decay starts with plaque and bacteria building up on the tooth structure, creating acid. This acid begins to erode the hard protective coating on the tooth, also known as the enamel. Once the acid breaks through the outside layer of the enamel, the decay spreads faster due to the inside layer, known as the dentin, not being as hard as the enamel. If the decay is allowed to expand through the dentin, it can penetrate the interior of the root, requiring additional procedures to remove the infected tissue. A range of external damage can result from this decay as well, such as cracking or fractures in the tooth, potentially progressing beneath the gum line and along the root structure. This could ultimately result in the loss of the tooth. It is important to detect and address issues of tooth decay early in the process to prevent these unpleasant and expensive consequences. Regular visits to your dentist, good oral hygiene, and a proactive attitude towards your dental health will help minimize this risk.
And then I have a video here about brushing your teeth, because most people don't actually know how to properly brush your teeth. So I thought this is really important to share. So I'm going to play this one. And then after that, I have a video about flossing, because the two most important things you can do to keep your teeth are brushing twice a day. So twice a day, each time you brush should be 2 minutes a day. The other thing I love about electric toothbrushes is they have a timer on them. So they will tell you that you are not done brushing in time. And flossing at least once a day. So we're gonna watch the brushing video and then the flossing video.
Keep your mouth healthy. It's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles don't break. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
Okay, and the last video here is about flossing. Okay, so those are just a couple of videos about brushing and flossing, because really that's the most important thing we want you to do as patients. And use an electric toothbrush. I see probably if with patients that I see from now till the 6 months when they come back, if they get an electric toothbrush, it's almost a 60% improvement in their oral hygiene, so much better. And your teeth will feel cleaner, and you'll notice once you start using that you don't want to go back. So that's all I have for you guys today, but I would love to take any questions you have.
Okay, thank you, Rekha ji, for a very good, excellent presentation. Yes, we do have some questions. I just thought about, while you were showing the flossing video, I remember a few people use threading, threads to do the flossing. I don't think that's safe, right? Am I correct in that?
Thread, like sewing thread?
Yes, sewing thread.
Yeah, I probably wouldn't recommend using that. One, it's probably too thin, but then the texture of it, you don't want to cut your gums. So you would have to be, yeah, I would not recommend using that. I would use proper dental floss. And one thing they didn't show in the video, so when you're using floss, I like to thread it around my middle fingers. That way you can use your index finger to really direct the floss, especially if you want to go to the back. So you can get your hands in there, especially if you have kind of thicker fingers, that can be a problem. And when you're flossing, you want to make a C shape. So because you're going between two teeth, so you want to make sure you're cleaning both sides of, each side of both teeth.
Mm-hmm. Okay. All right. Yeah, that's fine. Yeah. And what about, like someone has asked, what about the dietary habits related to gum and tooth issues? Is there anything that we have to watch out on?
So mostly we see a dietary component with tooth decay, which is like sugars and carbohydrates, could also be related to dry mouth. With foods, and I'll see a lot of times, especially ethnic foods with a lot of turmeric, cause a lot of tooth staining. It's not necessarily bad, but you just want to make sure after you eat that you brush your teeth so that staining doesn't like get stuck on the teeth. So mostly like the food and the diet, obviously your general health. So if you're eating healthier, your body tends to be healthier, your mouth tends to be healthier. So we like to say fruits, vegetables, healthy things, stay away from the sugars and the refined carbohydrates. So like white flour, that type of things are going to like cause everything to kind of get more inflamed.
Okay, so I guess it's just like as the title says, right? Healthy mouth, healthy body. So
Yeah.
all the doctors say, okay, that's fine. How about putting a cap in a tooth that could have, could have infection? Like, some people don't want to visit a dentist just because they think that, if they go to the dentist, maybe it will indirectly, lead to infection. So is that true myth, or is it
that putting a cap, if you
cap to the
that it'll cause an infection?
Mm-hmm.
So typically if we're putting a cap is what we call a crown. So putting a crown on a tooth is needed because usually the tooth is undermined, meaning it has a large cavity in it. So there's a couple of reasons we use a crown. So if it's got a large decay in it, or if there's a fracture in the tooth. So typically when you need a crown or a cap, that means 3/4 of the tooth is already compromised for whatever reason. And about 30% of those teeth do end up needing a root canal, which could mean that they could get infected. So it's not necessarily that the crown causes the infection. It's really more so that the tooth is probably already like pretty broken down. And that's what leads to that. One thing I think I like people to remember is, so like I said, teeth all have their own little nerve system, and your teeth are not really that big if you look at them. So it doesn't take that much for the cavity to get to the nerve. It's about 7 millimeters. So, 7 millimeters is like, so bacteria doesn't need to go very far to get into the nerve, which is when you need a root canal or like that. That's why it's important to make sure you stay on top of your dental checks.
Okay, thank you for that. And just a common question I think people have, like when they drink water with lemon, is
Mhm.
it safe to drink, or is it like, they worried about losing animal on the top? So is it safe to drink, or how often should they do it?
Yeah. So I think there's a lot of health benefits to drinking. I think it's room temperature water with lemon. First thing in the morning, I think is what it is.
Yes.
So the lemons are acidic, like any kind of citrus fruit. The body has saliva, so saliva buffers acid. So if you're just drinking your 1 glass of water with lemon in the morning, you're probably fine. Now, if you're drinking lemon water all day, every day, then yes, that's going to create acid attack on your teeth. That's also like people who drink soda all day. That's why they get a lot of erosion and decay, because that acid is constantly it's never able to be buffered, because every time it starts to buffer, you're adding more acid. So 1 glass of lemon water a day is okay. Chewing on lemons all day, not okay.
Okay, okay. All right. How about dry mouth? What are the symptoms of dry mouth? I mean, I know it says dry mouth,
Yeah.
but anything else more to that?
Yeah, so sometimes with dry mouth, you'll have obviously dry mouth, but you can have like kind of a bad odor coming from your mouth as well. As well, sometimes some people have burning sensations. Um, there's a lot of link between dry mouth and medication. So especially in our like elderly population who are on multiple medications, there's typically side effects of dry mouth. And one of the things we like is we need to be sure we're communicating with your doctor about your medications. If it's causing that symptom, if there's something alternative you could be on, do we need to put you on? There's medications that you can use for saliva substitutes if things are really bad, or usually we can try to control it with increasing our water intake, as well as oral rinses. Like Closis was the one that I liked. I think the most common dry mouth rinse is Biotine, but I have not really had good, I don't really like it that much since they reformulated it. So I've been using Closis for my patients. There's some little mints you can get called Xylamelts. That's with an XYLI. Those help with dry mouth as well. And obviously drinking lots of water. There's also, if you're not on medications and we're getting a lot of dry mouth too, we need to kind of identify what the cause is. So if you're a mouth breather, you sleep with your mouth open, that could be why. But also like younger females are at risk for certain autoimmune conditions like Sjogren's syndrome, which cause dry mouth. So that needs to be identified and treated in coordination with an MD as well.
Oh, okay. So it's not as simple as just dry mouth, right? Yeah. Okay. Okay. How about like sometimes when we visit a dentist, they say our gums are very so we cannot have a denture.
Mhm.
So like there are two different types of dentures, I guess, right?
Yeah,
Soft and hard, whatever. So can you throw some light on that?
that they say that you can't have a denture.
Yes. I mean, it's like some people have like a permanent denture versus
Oh,
the removable.
okay. So anytime you lose a tooth, there's 4 ways you can treat a missing tooth. So the first way is don't do anything about it. And then obviously the negative impact is the other teeth around it are going to start to shift and move into the space.
Right.
You're going to be biting on the other teeth incorrectly, etc. The second way to fix a missing tooth is sometimes you can do what we call a bridge, which I think is what you're talking about when you say fixed
Right.
denture.
Right.
A bridge is typically when if there's a missing tooth here, we cut down the tooth in front of it and behind it, and we put a prosthesis on there that has kind of like a floating tooth in the middle to give you more of a solid occlusion or bite. The third way to replace a missing tooth is a dental implant. And a dental implant is basically it's a titanium screw that goes into the bone in your jaw or in the maxilla, and it integrates into the body. So dental implants are the ideal way typically to replace a missing tooth because we can save the bone there. Once you take a tooth out, the bone also starts to go away. So those are kind of the like 4 ways to, did that answer your question?
Yes.
Okay.
Our like old people, right? Sometimes they have the gum disease, I guess, so
Yeah.
they cannot have.
Right. So if like the teeth like are not stable, you know, we can't put a fixed prosthesis on there either because they're likely to kind of break.
Right.
And when you get to the point where you lose all your teeth, that's when we're talking about full dentures, which nowadays even full dentures we like to do with at least two to 4 implants to help retain it, because you're never going to have the same chewing efficiency, aesthetics as you would with a denture, because it's something that just kind of snaps into your mouth. They're never really that stable. So when we use implants, so we kind of recreate having some teeth there, and the denture will snap into that, and people get much better aesthetics, chewing efficiency, all that kind of stuff.
Okay, thank you for that. Okay, another just a small question: why do people have chipped tooth? Why do they get it? Is it due to some deficiency or anything?
Chipped teeth. So usually if like you have a chipped tooth, it could be from trauma, like you.
Oh, right. Yes. You mentioned that in the slides, right?
Yeah. It's something. But most commonly what we see, like kind of if you say, like if you're talking about like all your teeth are kind of worn and shorter, it's almost always because of the way that their teeth bite together. So if your teeth were never corrected into the correct orthodontic position, you know, we like to obviously do it when younger you are, it's better. But over the years, if your teeth are kind of incorrectly functioning, they get worn and worn and worn and worn and worn. You know, so that's usually why. There's also sometimes it can be related to acid. Sometimes patients with acid reflux, if they have acid reflux really bad, or bulimia, the acid will erode away the enamel, and that will sometimes contribute to that too.
Oh, okay. Thank you for that. Another question we got is, any ideas for temperature sensitive tooth?
Yeah, so typically like temperature sensitive teeth, most commonly the reason we see is because of recession, gum recession. So the root is exposed, which is what's causing the temperature sensitivity. Especially as we get older, we start to have some gum recession as well. The gum recession combined with the really abrasive toothpaste that are on the market now is what I see the majority of teeth sensitivity coming from. So my recommendation is to, if you've already seen your dentist and you know you don't have a cavity or something like that, is to use a sensitivity toothpaste like Sensodyne. Use like Sensodyne Rapid Relief. That should work in 3 days. So you'll know if that kind of helps to take care of that.
Okay. All right. Thank you. Someone has asked a question. Do flossing cause gaps between teeth?
No. What happened? That's a good question.
Right.
I think sometimes what happens is as we lose gum and bone around our teeth, you'll start to notice that you see gaps in between your teeth. People say that a lot. What that actually is the gum disease has caused bone loss in those areas. So when we see those little, we call them black triangles, it's because the disease has progressed to that. And then so some people will come in, they'll get their teeth cleaned, and so we remove all the tartar buildup that has been in those little areas. So that is, no, it doesn't cause gaps, but it might expose the gap when you get the food out of the.
Oh, okay. So they can see, like they can see the gaps now. Okay.
Yeah.
Yeah. Okay. So someone has asked, why is tooth pain worsen at night?
It has to, it's usually if it's an abscess, it can be positional. So when you lay down, it has something to do with the pain is transmitted. But we do see if tooth pain is worse at night, that is usually a sign of infection.
Okay. All right. And
As well as pulsing and throbbing. So also those are all things to look out for infection.
right. Okay. Okay. And should someone brush the aching tooth?
Yes, because you want to make sure you keep it clean. So I would, gently brush. You don't even necessarily have to put like a lot of toothpaste or anything. You should only be using a little bit of toothpaste and then kind of gently brush that area because you don't want to get food and other bacteria on there and then propagate that problem.
All right. Okay. Yes. Yeah. That sounds okay. Then someone has asked, what should you not do when you have a toothache?
What should you not do? You should not leave it and not get it checked out.
Okay. Let's go. I mean, what you should do is go and see Rekha ji. Okay.
What you should do is go and see the dentist as soon as you can.
Okay.
What should you not do? I've had people try to pull their own tooth. Don't do that. There's really not, I mean, you can medicate at home. Typically, two regular Advil and one extra strength Tylenol is good for tooth pain. So you can kind of do that to calm it down before you go and see the dentist. Sometimes if like you have a hole in the tooth or something and you're on vacation, something like that, if you go to like a Walgreens, they'll sometimes have like temporary, you can put like a temporary kind of thing in there. Don't use super glue or anything like that. We don't want to put anything that's not like okay to put in your body, in your mouth. You're laughing, but people do it.
Oh, do they really? Oh, okay. Okay, like I've heard about, they put cloves or something like that, loving. Yeah, they put that, but.
So actually, that's a good question because actually one of the materials that we use has clove in it. So that's why it creates some of that desensitizing property. The only kind of issue with that is that how clean is that, right? Like if they're getting it out of their kitchen and it's not been, so I don't know if I would put that like in my mouth. But that's where that kind of came from is historically that does help with tooth pain.
Okay, all right. Okay, I think we're getting a lot of questions answered. How about baking soda? Is it healthy to take baking soda? Does it have any effect on our
to drink it or
yeah
to brush with it?
Yeah, to floss with it.
So you can mix a little bit of baking soda with water and gently brush. I wouldn't recommend doing it all the time. Baking soda, it will remove some of the surface stains on the teeth, but it doesn't really whiten your teeth. But it's okay to use maybe like once a week if you're using that. I really don't like baking soda toothpaste that much either. I like to stick with really gentle toothpaste because we have a lot of acidic things in our diet and everything now. So we don't want to add more things that are wearing down our teeth.
Okay. How about salt? Like when we were young, right? We used to take some salt in the hand and is that still okay or?
I wouldn't do that. It would really depend on the abrasiveness of the salt. And now salt comes in so many different varieties. But I wouldn't recommend doing that.
Oh, okay. All right. I think
we get enough salt in our diet too. We don't need more salt.
Right. That's true. Yeah. Thank you very much, doctor. And I just wanted to, before we leave, I just wanted to, tell everyone that right now we are having Ram Katha Rahasya going on till October 10th. And then on Tuesday, we'll be having Swamiji will be talking about Sundarkand. And then October 10th, that's our finale. So we'll be having Ramji's Raja Abhishek. So do join us for that. And then Swamiji has released 21 day of mind management challenge videos. So I think we have already released up to day 10. So on Monday, we'll be releasing day 11. So do watch out for those, and then, try and register yourself on jko.org for online sessions that JKO Academy is running. So those are all beneficial, and those are all free. Okay, so you can watch the videos, join us on Zoom, and connect with like-minded people. And a lot of people benefit during this COVID time. So this is the best activity that people do right now. Okay, so thank you very much for the wonderful session, and thank you very much, Dr. Khandelwal ji. Thank you. Radhe Radhe. Radhe Radhe. Good night. Thank you, Dr. Khandelwal ji. You can, let me unmute you. Hold on. Yeah, you can unmute yourself, Dr. Khandelwal.
So it's good. And salt also, salt and sarson ka tel, mix it when there is a gum problem.
We used to do that. We used to take salt and do,
In India,
in India, we used to do that. So that
tail and salt. If there is a gum is swollen, it and take out the water, and it really